Welcome back to Nothing But
Answers.
a place where you can come to get all the answers you need because we have them, all of them.
Yeah, we do.
So don't even worry about what you think. Just listen to us. Now, I know you're looking at the screen like, yeah. We're a little short-handed. Right. We don't know why we're short-handed either, but we're going to make it do what it do. So let me introduce lovely co-host tonight because we don't know where everybody else is. Neil, how are you doing?
I'm good, D. Thanks for asking. Run around as usual, Fridays are run around, grab my time, make the errands happen, look at the watch, get panicked. You only got an hour to go.
All right.
But I get it done. I get the groceries back in, get them put where they need to be, and I'm like, boom, time to go. So good week, rush around Friday. How about you?
It was a good week. At least we're here on time. So
already.
I wasn't even talking about nobody who was here not on time.
Hi, Doc. I'm glad to see you anyway.
Hi. Sorry, I lost track of time.
We just lose track of time we want now. Huh? That's what we're doing. It's only every Friday at 8 o'clock. 8 o'clock. Okay. Lost track of time. Hope you found it.
You know what? I did find it because I made it.
Okay.
And that's what matters.
That's all that matters.
That's it.
Okay.
There.
If it's all that matters, I hear it. These people out here just coming when they want to come. So, Doc, how was your week? How's everything?
Okay. Yeah, pretty good. Busy, but what?
You're going to come on late with one word answer.
She said pretty good. 2 words.
Pretty good. 2 words.
Two words.
Quick. It was quick. How about that?
This is what we're doing.
It's that kind of day, Daryl.
Let her settle in, Daryl. God.
It's that kind of day.
Stop cheerleading for Doc. Let Doc fend for herself.
That's my girl. Leave her alone.
Ruth be in the back, like.
That's right.
Yes, girl power.
We're gonna stop that. Okay, let's cut it out.
All right.
So yeah, I had a pretty good week as well. Week went by pretty quickly. We're here again. Work was working this week, which I don't like to work because I don't pay. Talk to somebody about this. That they're trying to make me earn my paycheck. I'm not sure when that started.
Nerve of them.
Yeah, how dare they expect me to do the job they hired me to do? I don't get it. I don't like it. Okay? Like it. So we can't do that anymore, right? We can't. This was a tough week. I'm drained. Okay, I'm drained. They worked me like they hired me to work.
Like Grandma Ruth says, they got the butter from the duck this week, huh?
I don't know what that means.
That's what Grandma says. She always said, when you're drained and worked to death, they get the butter from the duck. That's all I'm saying. I don't know what it means either, Daryl.
No, I don't know. I'm not even gonna repeat that because I might be saying something wrong in the wrong room. I be like, "Oh, you got the butter from the duck." I'm cool on the butter from the duck. I don't know.
That's a Grandma Ruth term. That's good.
We're gonna stay away from the butter and the duck. Okay. The whole situation alone. Okay.
All right. I won't use her quotes.
Thank you.
You're welcome.
Oh, look at it. It's my best friend in the world. Everybody's Peaches.
Oh, my
hey, Miss Peaches.
No, I don't know Peaches. Who's Peaches? I thought thought it was Leanne.
Pages.
Don't entertain them, Doc. Don't entertain them.
Dang, that's peachy. It's peachy. You know what I mean?
Hey, Lee.
Hey,
Lee.
what's up?
Somebody said you were scared of the topic, so you weren't showing up today. I won't give any names. I asked where you were.
No,
The
listen,
disrespect.
listen. Why would you do that?
I didn't give names. You gave yourself up.
No, it was me. Because we had a conversation. Why would you do that? It's supposed to be a code. You're supposed to break the code, and you broke the code. You're trying to break it.
Girl power first, Daryl. Girl power always first.
Yes.
Sorry.
Trying to have dissent. Dissent in the rank. Now, remember, hey, Pudding. How you doing? How was your week, Pudding?
That's so sad.
Oh, he was cool. That's fine.
Okay.
Good.
So you gonna be like Doc? Just the one-word answers, late and one-word, two-word answers. Okay. Okay. So let's get into it. Really. So our topic for tonight, we're gonna talk about menopause. I don't know anything about menopause, so hopefully this will help people learn a little bit more about menopause. I did invite a doctor to come on, and they said they should be signing on in about 20 minutes to actually help us give us some real tips and things about this, because we can share some things that we may have read or learned or things of that nature, but may be able to answer some of the questions we may have. So if you have any questions, it's cool. Jump into the comments, put the questions there. We will, when the doctor comes on, we could read them to her, have her answer. Or if you want to answer questions, you can ask it in real time as well. So like I said, we will have a doctor on in about 20 minutes for a little bit to help us out with the show.
Excellent.
Help us out. So I think that's cool. That was really cool. The doctor is going to, give us some time. So we'll have two doctors on here. We have Doc and Doc. like, what's up, Doc?
Hey, Square.
Doc Square. Hey, Peaches, you okay over there?
Yo, first off, start calling me that. What's wrong with you?
I thought you leave me. I thought you leave me hanging tonight, please.
No, I'm here. I'm good.
So now I got to mess with you, Banana.
You know what?
You just a fruit salad tonight.
I know, right?
Oh my God.
I understand.
You all right, D?
Yeah.
You all right? That's the question.
I'm making sure putting pieces of bananas all right. All right. So let's get into this menopause thing. So I know I titled it "What's Getting You Hot," right? Because
that's disrespectful.
That is so disrespectful.
Hot, right? What's getting
We're gonna let it fly. We're gonna let it fly.
I bet y'all got a fan right by you already now. I bet it's a fan. Look. Here it comes. Look at that. On fire.
A double fan.
Double fan. So,
right there, ready.
So I don't know where to start. Whoever want to jump in, like menopause. What are we doing here? And I don't know much about it. All I know about menopause is you can't get pregnant, so you don't need a condom.
So what?
Wow.
All his knowledge is disrespectful.
Sounds like it sounds like a good time to me. I could be wrong, but it sounds like
That's what a lot of us thought. We found out the facts otherwise.
Yes.
So what are some of the facts? What's menopause? Let's go.
Well, first of all, it is when the ovaries stop producing hormones. So,
Yes,
there's a decline in the reproductive hormones for the woman.
Mm-hmm.
Okay.
Hence, maybe why you think, that's a good time to up the ante with, sexual whatever, without the chance of getting pregnant. But there's a lot more to it than just that piece.
So I was looking at something, and they said that some women who are pre-menopause or sometimes mistake it for full menopause, and they still end up getting pregnant. Because in pre, I guess if that's what from my understanding, it sounded like you still you kind of have symptoms, but you're still childbearing, and where you guys get caught up because you thought you can go all diggity.
That's when you have that change of life baby.
That's the change of life baby, exactly.
And you know what? I was talking to my GYN, and he said that he has had patients who have gone fully into menopause, came out, had one cycle, and got pregnant. In her 50s.
Wow. This the
in
bullshit.
Their 50s.
We can't even take down a 50-year-old without maybe thinking about getting her pregnant.
Yep.
Oh my gosh.
Yep.
It's happened. It has happened.
It can happen. It can happen.
That's
it's really our bodies are such mysteries. We know a lot, but there's a lot we don't know too.
Okay.
I'd agree with that. Yep.
Very interesting.
And hormones play a huge part in a lot of stuff that goes on with our bodies. And they can be erratic, I guess you want to say. I want to say erratic.
Is there an age? I don't know. Is there an age that this kind of starts or begins at, or where you should start to worry about this?
I mean, typically, I would say mid-40s to somewhere in your 50s, but there are the outliers. Some people, I've heard of people starting in their late 30s.
Yes.
And some people not going into full menopause until they're in their 60s.
It can vary just that much.
Wow, very interesting. And
it's not even considered full menopause until you haven't had a period for over a year.
Yes.
Okay.
12 months.
So menopause starts in a year. Well,
the absence of your cycle for a full year. Now that doesn't mean. I'm sorry, Daryl.
No, I would say so. If you did in 3 months, you got a period. Would that year start over from that time?
Yes, that's what I was going to say. That means consecutive months. Yes.
Okay.
Because we've had people say, gone all the way up to 10 months. Damn, here we go. Here comes that cycle, and you got to start all over again.
Well, that's kind of stinks because I've probably been doing it raw for 10 months.
Oh Lord!
I got to worry.
That's when you thought it was safe.
That's when you thought it was safe to go in the water. Yes, Doc.
It's what I don't need anymore. I need it again. Damn.
Yep. So as Doc is saying, the bodies can do all kinds of things. They can be erratic, inconsistent, disrespectful on some level.
Yes.
Yeah. Now you alluded to in the beginning that there were some things that were not so fun about it. Like what wouldn't be fun?
Oh, we don't have enough time for my list of the things that are not fun about it. But
the most common one is the hot flashes. That's what people talk about all the time.
Yes, Doc.
Okay, so let's stop with the hot flashes real fast. How do they affect me? I need to know how this affects me.
Okay.
Not about y'all, about me.
So how do the hot flashes affect maybe the man in your life, right?
I don't have a man in my life.
I'm saying from our perspective. Smart ass.
I not sneak one in there, but I'm on top of things. You ain't gonna catch me out there.
I think he know what I meant. Anyway, it can affect you. It will affect you most likely, because it affects her so much. Meaning, she's hot, she's uncomfortable at times. She's irritated. She may be moody. She may not get your jokes during that hot flash. Stop.
That's not like Tuesday. I don't know what's different.
It can affect, how you need the temperature in your bedroom.
Okay. See,
what kind of covers or what kind of situation you need on your bed.
True.
That can affect your partner as well.
It can affect the way you dress.
Oh, this is why your pictures are half naked? I'm sorry.
You got it. You're hot all the time.
You got to read.
You need to dress a certain way. At least I do. Layers. Yes, layers. Yes. Seriously.
And you might not want to be touched because of the discomfort of the heat.
So how long to the divorce? I'm just asking, does menopause lead to divorce?
It doesn't lead to divorce if you communicate. There's that C word again. You let your mate know what's happening when it's happening.
Oh, so
and some understanding from your mate.
Thank you.
Understanding. Don't look away. Understanding.
You said, how does it affect you? You need to be understanding. Doc is right. Have some compassion, empathy for what she's going through.
How about what I'm going through?
You'll be all right. You'll be all right.
So I think is it a sudden change? Honestly, it's kind of sudden. Like, so say if we were used to doing it, 3 times a week, and does that just menopause and kind of just stops, or is it over like a time here where it kind of slows?
I don't think so. I think that really depends on the person. Yeah, I don't think it has to. I mean, there are some other issues like with discomfort, because if you have like vaginal dryness or soreness when you have intercourse, that could affect your desire or your how often you want to have it, especially if your mate is not understanding
or well endowed. Sorry.
And it could actually interrupt sex. If you're having sex and you have a hot flash, do you really want somebody on?
That's a very good point made there. Very good point.
I got a point. I'm gonna finish. Then it ain't going to interrupt.
Hot flash and all, huh?
Flash and all. Poor woman.
You hot.
Doc is right. And it can affect the libido itself, depending how extreme the estrogen drop is. The libido can either gradually, change where it's like, I'm still there. I still feel you, but not as often. Or it could be for some folks, it's gone. Dead, gone.
Once that estrogen drops, can it come back up, or can you do?
Can't replace it, to my understanding, without a doctor's replacement, right?
Wow.
Yeah.
So does the divorce come then?
It could possibly, yes. I know you want an exact divorce time.
When this thing, like, hey, this thing that ran its course, we did the best we
could. But we're chuckling, but you know what? There are a lot of folks. It does disrupt that relationship in a serious way at that point, because A, they're not communicating what's happening, and B, the other partner may not be as understanding, or as you're saying, say, what about me?
Right.
And that could cause a real divide, seriously.
And I think what you kind of said, communication is cool, but sometimes knowing that, like, this is important to me, I think, because knowing beforehand what you're going into may help you prepare for it.
Yeah.
And just, it happens. Like, if we're fine and sex life and everything is great, then all of a sudden you dry up like a desert, and you don't want
what?
His words,
right? That just make you want to just shrink away, like, oh man, this is what he thinks of me. Like, if you said that to your partner, she would probably be devastated.
I apologize for you to describe what I'm saying. I apologize.
And now you have to understand that she's maybe already feeling some kind of way about not being in childbearing years anymore. That's a hard thing for some women.
I know. They should get over it.
They feel useless.
That's great for me, because I can go Oh, but
and she could be feeling, you know, upset about all those things. You know, not being able to have children, not being the faucet that she was, if you will. Not
yes, exactly.
I can turn the faucet off. I say.
and the hot flashes with that sweating can make somebody, you know, make women feel embarrassed.
Yes.
Wow. That's very.
You can sweat profusely. I mean, like you could be looking at this person in 1 minute and their face is pouring wet. Pouring. I went through that phase.
Well, at least we can rehydrate the vagina.
You know what?
It's gonna be a long night. It's
gonna be a
long night.
We make it work for us. We make it work for us. We're like, come on, girl.
Oh my goodness.
But I'm saying for me, it would be it is good to would be good to know these things, because when you do really get to Bruce, it's not funny. I don't know what's funny. It's a serious conversation.
And I'm trying to do that, yes, but you are making it hard. Go ahead.
No, but it's very interesting because, like I said, this could be a real problem. I think if we didn't really know what was going on, especially maybe if she didn't know kind of what was going on, and then she can't express it to me, and I'm now the man is like, what's going on? And somebody else, or you can think a lot of different things. Like, you're not getting wet for me anymore. That could be a problem for us as well, right? We can feel some type of way not knowing what's going on. By knowing what's going on, we could actually now plan for that, right? You know, we can definitely try to do something to, you know, just get ready for it. Like, had your side joint be a little younger, so that that's not a good plan. Okay,
no, that's not a good plan
at all. At all.
No, but it is really good information, because it definitely seems like. So it looks like your relationship could take a very drastic turn at this point in life.
Yes.
For the relationship, both of you will be affected. What is happening, and it's probably, you know, kids are probably gone at this point. You two in the home. Yeah, I can see that being very difficult to navigate, especially if not knowing what's going on. And even knowing what's going on, it's you know, it's tough, because you want to be there for her. You want her to be able to be there for you, and it's tough showing up for each other in that time.
Certainly.
I think you make a good point, because if she's not aware that that's where she's headed, you know, because sometimes women don't know, and it depends on, you know, it could depend on age or those kinds of things. So you might expect it at a certain time, but it might not happen. It might happen earlier. And if you don't know that, and you're having these maybe subtle changes, like your mood and, you know, your libido, things like that, and you can't explain it to your partner, that could be a problem.
So you said her attitude. Well, I guess it's so many different things. Her attitude could change, because she could be more irritable.
Yes.
Have you had to ever treat anyone for, like, listen, they're going through this, they're irritable, how they can navigate that? Because it's tough if one person is really beating you up all the time, you know, and not that she's doing it on purpose, but it's tough that she's mad, irritable, and hot and cold, and taking the blankets and giving them back.
That's true.
Yes.
I'm going another room.
I actually had someone I was seeing not that long ago who was going through that, and I recommended a consult with her physician to get her hormone levels checked and stuff, and found out she was menopausal. So
it can it be? Is there anything through doctors or something that can help even this out?
Hormone replacement therapy, but that has its drawbacks as well.
Got you. You get a deep voice.
So hopefully the doctor can come on and, you know, talk about what are the real options that women can, you know, use that at least ease it, because there's no cure for menopause. Menopause is going to happen for every woman.
Gotcha.
But how do you make it I don't know, better or not as tough on you?
Yes, man.
Make it manageable.
Good word. That would be the toughest part for me hearing about it, would be just the, you know, her changing and dealing with it and being more cranky. You know, that's
real.
That's tough. That could be tough on both.
Yep.
And like I know what she's going through, but I don't want to continue, kind of snapping at me because I didn't take the trash out right when she said.
But there are some natural things you can do to try to help yourself too. And I too want to hear from the doctor what, medical pieces we can do if we choose to. But the natural things can sometimes just help make it more manageable too. Like for me, it's exercise. I have to exercise because those endorphins in some way balance out my hormones a little bit better. I can tell on the days that I'm not as, physical with my workouts that I'm a little bit moodier or crankier or however you want to say it.
Now, would that make you or exercise already makes you hot? Would you be make you extra hot? You're not being okay.
Yep. You can have a hot flash while you exercise.
Oftentimes, and I push through it because I know I'll get a better end result after it's over. But yeah, you get really hot.
Okay, so it's just uncomfortable because you're hot. That's what makes it. Okay.
But again, I put a fan on my bike. I have a little mini fan right on the bike. There are things you can do to help yourself through that. But it's going to hit. I mean, it still hits.
Gotcha.
And exercise is good too because a lot of times menopause comes with weight gain.
Actually, it does. Even for the thinnest person. Seriously. Yes. I gained 10 pounds and didn't know where it came from.
This menopause thing is a demon.
Daryl's like, whoa. Yep.
I would wish this on my worst enemy.
No, you wouldn't actually.
I wish menopause on you. I can't believe you did that. This is
no, it's real. The weight gain is real.
Gotcha.
And it's almost like you can't do anything about it if your hormones are going crazy at that moment. Even with working out, it was like, this is not getting better. It was a hormonal surge of some sort.
Your metabolism gets slower. So
it's very interesting. It's definitely something that I think needs to be talked about more because just hearing what I'm hearing, you need to prepare for this.
Yes, you do.
You need a class on this because it seems like it's a lot that comes with it. It's a lot that's still unknown about it. It seems like I hear it can each woman kind of experiences it differently.
Yes.
Right. You need to know what to look for and prepare for. And as men, we need to know that she's not tripping just to be tripping.
Right. Yes.
There's something behind that. She can't express it like, oh, I remember that class I took. I know what's going on. But don't think every time something's going on, it's menopause either. That's when we get cussed out probably too. It ain't her mother. She ain't menopause. You want to get cussed out.
No, you don't use it as a crutch, Daryl, but we do need some conversations and lessons on it because it's taboo. It really is something we don't talk about. Some women try to hide the fact they're going through it. I'm sitting there fanning, I could care less because I'm trying to get some relief. But some people are embarrassed by it. And it's just not talked about the way it needs to be openly.
Right. It's so funny. I went on a boat ride this summer and all the women had the little fans.
There you go.
This one is battery operated. It keeps me cool. I'm like, I don't know why you need a fan. It's crazy. But now they probably were going through it and using a fan to cool them off. Very interesting. So hot flashes, are there cold flashes? If that makes sense.
Cold sweats.
And often they come right after the heat for some folks. Okay. Right after it, you're cold because like I keep my hoodie because then I got to put that right back on because I get cold.
This is going to be tough. I said it's tough to deal with. You want me to get your jacket? You don't want your jacket no more. You want your jacket again?
No, Daryl, there are ways around that too. By dressing in layers, I usually wear this side around me, so it's ready to go.
Okay.
It's ready to go. You don't have to get it for me.
So that's good to know. Like, because if you don't, you like, so you don't want. I just gave you playing, right?
Turn the heat off. Wait, turn the heat back on. Right. Turn the heat off. Wait, turn the heat
right.
Off.
Window up, window down, covers on, covers off.
Right. That is.
It's crazy.
That is insane, and I can see how it could affect with you mentally.
Yes. Yeah.
I can see. And I think someone said, like you said, it makes you feel like you're aging.
Yeah, yeah. It's like that last phase. Like, okay, I'm getting there. I'm there. That last phase. Mm-hmm.
Okay. Like
and brain fog. It makes you forget. For some women, you get very forgetful. Mm-hmm. Yeah, that's another aspect. Mm-hmm.
Very interesting.
Oh, it is.
And like, even we'll ask kind of you guys, but did anybody ever talk to you about this growing up?
No,
not me.
Okay.
Grandma Ruth again. All I heard was you can go crazy, you can have a baby, and it was one other thing. You can go blind. Those were the three things she told me that the change of life can do. Real talk. That's what she said.
Can you go blind?
I've never heard of anybody going blind.
I've never heard of that either.
God dang,
oh God, please! I'll be the first one. Grandma Ruth put it on me.
I'm hot.
Those are the three things she said, and that's all I heard about it.
Okay.
That's ridiculous, but that's all I heard.
Well, I mean, and it's funny because that's probably what she was taught.
Mm-hmm.
Right?
Mm-hmm.
Repeating what she thought, the urban legends about it.
Exactly.
You go blind, you get hot, and your eyes dry up. I can't see.
And then I'm worried that all three is going to hit you at one time. Then you really don't.
Right.
Wow. So you had some fears over what you were told, because and this is why it's important. And it's important just for us to know about health in general, right? Our health in general and things to expect, and I think we think we're going to live forever when we're young, so we don't think about these things.
Exactly.
But the goal is to get old. To be honest, like that's the goal.
Mm-hmm.
The goal is to get old. So these get older,
older.
I was trying to remember if they talked about it in the sex education class that I had, because I did have a health class.
Okay.
In high school, but I can't remember if we went that far.
Yeah.
No, I think it was more around like teen pregnancy and what sex was and things of that nature. And I think ours, and we only could talk about abstinence. They couldn't even talk about anything but abstinence. Mm-hmm. They weren't allowed to talk about anything else. That was
We had a good health ed teacher. Did you, Neil? Did you have Dr. Tittle?
I remember that name. Yes, I did.
I had her for health education. And she was the first person to talk to us about intimacy and it not being about sex.
Yes,
I remember that in our class.
Mm-hmm.
Yeah.
Excellent. Daryl missed that class.
Because I was already having sex. I didn't need a class.
No, the intimacy without it class.
Yeah, you're right. I did miss that class.
You were absent that day.
I was probably having sex.
Yeah,
I don't think we went as far as menopause. I don't think
so. And that's what's really disheartening, because it's almost like that part of your life doesn't matter on some levels. It's like, okay, you go old and that's it. And we don't have to talk about what you're going through because you'll be dead soon. And, it's just a negative connotation. I don't like it.
Yes.
Well, I mean, you guys haven't said nothing positive about it yet. I see why it's negative.
There's some positive things, Daryl. Like you said, you are granted the blessing of getting older, hopefully with grace and health. And yes, it may be a little inconveniencing to you here and there, but you're getting older gracefully. It's okay.
No periods. That's
no periods
to a lot of women.
That's a great one. That one I love.
We agree on that. We all love that. Let's get her period. We don't like that.
You don't want to replace it with the hot flash and the cold, and you don't want to replace it. So yes, that is a good part of it. Are there
no babies really, unless your hormones get funky? And
yes, right.
No babies generally.
Yes. So there's another positive point, Daryl.
Well, I mean, so it's like 900 negative, and you got 2 positives.
And it's funny you said that. I think right now there are 50 negative symptoms connected to menopause. Something like that I saw. 50. Yeah.
Wow.
Sounds about right.
Yeah, that's about it. But again, like everything else, I do think it's a mindset. And I think you have to get your mind right, and you have to realize, okay, I'm in it, and how can I get through it to the best of my ability? What can I do?
Have you guys talked about it with your friends? Like around friends, have you guys kind of discussed it?
That's a good point. I have with certain circles of girls, of women friends. Yes. Mm-hmm. I don't know if Doc has, but
I think women need to have, be more comfortable talking about these things to women, and then educate the men around them as well, especially as you get closer to it. Like I said, all I'm hearing, I would think that, oh, she's cranky. She's, you could think a whole bunch of different things that would be totally off.
Yep.
And if she's irritable, maybe she can't even express herself, and now you guys are arguing. And I'm like, girl, you mess with. I ain't messing with nobody else. See, I knew it. You got too mad. You got mad like you trying to trick me.
It can go to 10 real quick. It can.
It's like, oh, why you sweating? I watch CSI. You sweating because you lying.
That's when it's at.
I knew it. You out here cheating on me. Right?
Cheating. That's right.
So that would be. It could be I could see this being very detrimental to a relationship.
It can be.
It could be, yes. It could be.
Together for a while, you guys are on a nice stride,
yep.
And then this.
Yep.
It's like somebody pulled the e-brake.
Yeah.
Everything stops. Your world changes. You're just home like this as a man, and it can't get help. There's no help for it. She's like, not tonight. What you mean? It wasn't not tonight, last night. Like, what are we doing here? I got the KY and everything for you.
Now, the other part of it, Daryl, is you may be fortunate enough to have a mate that's older or as old as you, and they may be going through their own hormonal decline. They don't talk about the men with the decline as much as the women, but they go through testosterone decline as well.
Absolutely, but we're talking about y'all. Don't bring us.
Oh, I know, but I was just saying when you were talking about that man at home like this, he may not be at home like this.
We have a pill. We fall down.
Everybody doesn't want a pill. Everybody doesn't want a pill.
If you want relief, pill it is. So at least there's some options. There's some options, but the option wouldn't be good for the other person. So you got to figure out how to navigate this new landscape.
Yes,
you do. You do.
And like I said, I think the best case scenario would be, hopefully, you guys are both kind of in it around the same time. Both of your libidos have dropped. Right. That
would be ideal. That would be the ideal. Yeah.
It's funny. I was talking to my friend the other day. He said his wife became more like it. She's in it, and she's
even more so
all the time.
I've heard that too.
I've heard that as well, because you feel more free.
I've heard that.
But he said he's the opposite. He's like, I'm not. He's in the later stages. Like,
okay.
He got pale menopause. He's like,
yeah.
Get off of me.
Wow.
And he said it's causing arguments in his home because she's like, who you with? Because you're not doing it with me. Who are you with?
Exactly. Wow.
Me, myself, and I don't want to. I want to read this book. He's like, yo, he said, I just want to read a book. He don't have those urges at this time.
That's a good point. It could be the other way around.
Why do people jump to who you with?
Right. Why is that the first
go-to? Who else you with?
Right. Why is that the first thing?
I guess that's just the trauma we have, and we always think it's somebody else when something's different. I'm trying to get the doctor on.
Okay.
Oh, she's coming in.
Keep talking.
Oh, you want us to keep talking?
Absolutely. We're thinking silence.
Let's think of what we haven't talked about with it yet.
Peach, you should have jumped in there on that when it got quiet.
You know what? I'm looking at a list, and there's one symptom on here I'm surprised by. I didn't
Which
know
one, Doc?
Loss of breast fullness.
Oh, I didn't know that was a symptom.
First time I've seen that.
I thought that was just from nurses nursing 2 boys that were hungry. I didn't think that was a symptom. God.
Hey, babe, you been breastfeeding somebody? We ain't got no kids. You supplement somebody. What's going on? It ain't what it used to be. I know what it used to be nice.
I mean, I guess it makes sense because hormones make them grow. When you're a teenager, right? Hormones make them.
Then it just goes the other way. It regresses.
Yeah, so that makes sense. It goes the other way.
Oh Lord, that's the first time I've heard that one.
Me too.
Add it to the list. Wow. Can't win for trying over here.
Thinning hair and dry skin.
Oh wow, it gets worse for you guys.
So she gonna look like another person too.
Hey, babe. Your hair.
A lot of changes there. A lot of changes.
So is that why a lot of times you see women when they get older, they have shorter hair, they cut the hair shorter? Maybe? No?
It may be that, or maybe from the heat. A lot of women, my friends that have done the short hair, say they're too hot for the hair.
God,
yeah. Seriously.
You have like a little afro now.
Yep. A little fuzz fro is enough because they're hot, sweating. Yeah. Literally, I wore a ponytail for a whole year. Yes.
It's so crazy that, menopause has been around forever and they have not found a way to help it out. Like how make it, lessen it, make it better, or just not as because it seems like it's so many negative things that happen.
Yes.
From it.
Yeah, you would think we would be further along, I guess, medically with options, as Doc had said, but you don't get a lot of options, I think. I think it's either here or there. Like, you're going to choose this, this replacement thing or not.
I think your point is well taken, Neil, about it not being a big deal to everybody else. It's like, once you're an old woman, just stay over there. Go through whatever you're going through. We don't have
exactly.
We don't got nothing for you.
It's that cancellation stage, exactly, where we ain't looking at you anyway, so we don't care what you're going through. That's horrible.
Yeah.
Horrible. And I think because of that, we have to be louder about it. We have to make noise about it because women are suffering. I know a lot of women that are suffering. They are not finding that balance I'm talking about naturally. They are depressed, which is another symptom. They are, body conscious, like I can't get this body together and I'm working on it hard.
Yep.
They can't sleep. I mean, it's horrible. Horrible.
All those things are happening.
So it needs to be talked about. And I'm glad that at least tonight we, decided to talk about it.
Yes. And hopefully, someone who's starting to experience some of these things and, maybe they'll talk to their physician or sometimes you do, like with some of the women that I see, sometimes you have to talk to a therapist to just kind of help you just manage the emotions around it.
You're right, Doc. Yes. And I know I joined a couple of groups when it hit me. So I'm part of a couple of Facebook groups.
Okay.
That are for Black women in particular. What's that?
I'm sorry, they're menopause groups?
Black women in menopause groups I've joined.
Oh, nice.
And those are very helpful, I have to say, because people are sharing on a common ground and, you're not looked at as venting. You're really looking for options and help. It's nice.
It'd have been nice if we'd invited some of them on, but
well, I'm just glad to be in it. I didn't want to, but yeah, it is nice to have that outlet.
Does it ever smooth out? Like your menopause, do you kind of get like not that it's much better, but you kind of get a bead on it. Like, all right, I kind of got it. I know, like kind of like you said, I work out, I wear my jackets.
Yes.
You know, my husband knows if I'm sweating and I don't want to be touched, he knows what it is.
I think it does for some folks, Daryl, especially if you're in tune with your body. I've always been kind of aware of my changes going on in my body. So for some folks, yes, they do. They balance it out. Oh, there's the doctor.
Hey.
Hi.
Hello, Dr. Scott. How are you doing, Dr. Scott?
Can you all hear me?
Yes.
Okay.
Yes, we can hear you.
Hi.
So, how were you doing? Yeah, we were on talking about. Oh, this is Dr. Scott, everyone.
Hi, Dr. Scott.
Should I introduce myself and tell them
Yes,
my
please. Yes, please.
Well, as was said, I'm Dr. Scott, a board certified obstetrician gynecologist, and who I'll just, my background so you can know I have a bachelor's degree in biology. And I completed my studies which is now, it used to be UMDNJ, now it's Rutgers State University in Newark, New Jersey, where I went to medical school and did a 4-year residency in obstetrics and gynecology. So I understand you all are talking about menopause tonight, which is obviously, as a gynecologist, something that I deal with, being that I deal with women from, adolescence, birth control, pregnancy, after, and then menopause is kind of the later stages of life. But since I was working and I missed the beginning, you all can fill me in, or if you want me to answer, just tell me where we are in the conversation.
Ladies, I mean, please take the wheel. I don't need to know.
Well, I think we were waiting for your medical, feedback because we were sharing some, general things about it, personal things about it. But we wanted to hear that medical piece about what are some of the other options for women that maybe we're not aware of that are going through it.
Okay, so I mean, the average age of menopause is 51 plus or minus. Some women will go through it sooner. For instance, someone who smokes, but other reasons, let's say a woman had surgical menopause, you get a hysterectomy at 45 and they take your ovaries, you will go into menopause immediately, like in the hospital. So, and people, you may hear about it from other people, or, if let's say your mother or grandmother didn't really have the common signs of it, you may not know much about it. But it's essentially a stage in life that the majority of women will go through, and to varying degrees. And the things that you typically, which you all may have shared, you're going to go through are things like hot flashes, night sweats, mood swings, sleep disturbances, a dry vagina, decreased libido, hair thinning, dry skin, all of those things. And it's basically because it is a low estrogen state. So when we're born, we have our ovaries. The two main female hormones are estrogen and progesterone. And once your ovaries become what we call atrophic, they basically go through a process where they go from being a glistening like a grape to they shrivel up like a raisin. And then you no longer have the estrogen that makes the estrogen that benefits us as women. So then you have to start talking about what you're actually trying to treat. And not every woman will have hot flashes. The majority will, and to varying extents. They could be very mild. There's some women who don't have them at all. And they're not just at night. They could be all the time, all day. So commonly, we think about hormone replacement therapy, but people obviously may have concerns about taking hormones, what we call exogenous, meaning that are not endogenous, which is what your body makes. So there are other alternatives, which are natural things. So I don't know if people are listening, you can write it down. I'm going to tell you about things that are natural. You can get also about some medications, but anything I tell you is something that you should obviously research on your own and check with your own healthcare professional, because I don't know anyone's medical background. And some things you can take and some things you can't. They could be contraindicated based on you as an individual. But some simple things you can get are things like evening primrose oil, which you can get from the health food store, black cohosh. Sometimes if you're trying to boost your mood, there's something called St. John's wort. And then there's natural, then of course the hormone stuff, but there are some non-hormonal things. There's some natural things that you can take. And these two things I'm going to tell you about are things that I've taken myself. So I prescribe them and I know that they work. So one of them is something called Bonafide. I don't know if you can see this. Right. This is made, it comes from Europe. It's made from a Swedish flower. It's actually called, well, it's Bonafide is the company, but it's called Relizen, Relizen. You take 2 pills like every day. And it helps to decrease hot flashes. It's not something you can, you'd have to go either to the company or online. When I used to prescribe it to patients in my office, the pharmaceutical reps would come around and sometimes give coupons, but it's not like your doctor can't write a script. You either have to go to, but it's still, I've known about it probably over 10 years, but it works very well. Like I've taken it myself, and it may take 3 weeks, but in a week I took it, it took the hot flashes away. They will come back if you stop taking it.
Wow.
The drug that's out now is something, it's called Vioza. It's not oh, here, you can see it. It's not a hormone, but it basically works by, it kind of down regulates what's up regulated. So you have to read it. Obviously, that's something that based on your medical, you would want to consult with a physician because that is a prescription medicine. I'm taking that right now. It does work because like I have hot flashes. They can be debilitating. Like I don't really sweat, but for some women, you're in a meeting, you're talking to a group of people, and you start pouring sweat. So it can be embarrassing, disheartening. But the hot flashes can also be they can be not, they can almost be debilitating because it is unless you've experienced it, it's difficult to describe until you go through it. And if it's once in a while, it's fine. But if you're having them 4 or 5, 6 times every single day, then it becomes, it can become difficult to deal with, and you may want something. Now, as far as hormone replacement therapy is an option as well, because basically what are you doing? Because it is a low estrogen state, you're replacing estrogen. If there are certain things obviously you want to look out for, if you have had a history of, like, if you have a bleeding disorder or you've had a blood clot, you may not want to take hormones. If you've had any kind of cancer in yourself, I think a lot of people's concerns are thinking about, oh, it may cause breast cancer or something. That's not essentially true. Basically, if you have, let's say you have a subclinical breast cancer that is estrogen or progesterone receptor positive and you take hormones, it's going to help it grow, yes, but it's not going to actually, cause it, because cancer cells are just normal cells that have gone awry. So, I mean, there's obviously risk factors for that. That's a whole nother thing we could get into. But so, I mean, hormones, and like I said, it really just depends on what you're dealing. I mean, you don't have to do anything or take anything, but obviously it's an independent thing, and it's just based on how you're feeling as an individual. So a couple other things I didn't mention were like anxiety, like panic attacks. Some women have panic attacks. They think they're having a heart attack. They don't know what's wrong with them. They might go, you have brain fog. So there's so many things, but so with that, you have to initially, you may not know what it is, but as time goes on and you figure out what it is, then you can, do behavior modification to deal with that. But there are things you can take to boost your mood, like ashwagandha. I'm not sure if you all are familiar with that.
Yes.
Yeah, so that can help if you, especially with men, with when you're tired, you're tired, you may work long hours. Most of us have a lot going on. You're multitasking, and you just, don't need a boost that can help, as well. And like I said, hormones, I mean, are a great option as well, but that's just, an individual thing and something you would consult with a health care professional as well. And there are some, like in the area, actually, I work for Virtua, but not to plug Virtua, they are going to start like a menopause clinic. So some doctors specialize in that, and you can actually go there. It's going to be a center. It may be in Morristown, I'm not sure, but I just recently heard about it, where it's going to be all about women, and you can go there for, whether it's nutrition or weight loss, but as you're going through the change of life, because in addition to all the other things that I've mentioned, your metabolism decreases as well. And
Mm-hmm.
then you start to deposit, you get weight in areas that you don't like. It almost becomes not, it seems impossible. It's not. So there's so many aspects of that change there in life that we go through as women. But I think if you're well versed in it, and you kind of have an understanding and realize that you're not alone. Sometimes it seems like I go to work and I'm with younger women and they're like, "Oh, you're hot." Yes, I'm hot. I'm hot. I'm hot. And
Yes.
they don't understand. I'm like, one day you're gonna be hot too.
Exactly.
So
Mm-hmm.
you have to realize you are not alone. And if God blesses you to see 50, if you make it to 50,
Yes.
you're going to see, you will, unless you are in that minority and you don't see it. Like I was
Mm-hmm.
somewhere at a function the other day and my cousin was like, "Oh, I never had a hot flash." I'm like, "Wow." But I'm like, that's amazing. But and for some people it'll come and go away very quickly. For other, and it's no timetable to say when it's going to end. But I say the main thing is to just kind of realize you're not alone, and also to know that you have options. And a lot of times people don't, maybe subconscious, and it's not talked about often until I mean, obviously I talk about it because women come in, I speak to them, and it's something I've known about. But even in knowing about it, it's not really something I could identify with until I actually
Mm-hmm.
went through it myself. And now I have obviously a front seat to understand. And and I sympathize with these people even more. Whereas before they would come in and talk and I would listen and be like, wow, that's really terrible, it's a shame. But now I'm like, okay, let's see what we can do here. And so I also went, yeah, so that's kind of my spiel.
Mm-hmm. Mm-hmm. Wonderful.
How long does it last?
Uh,
Menopause.
well, it varies. That's the thing. Well,
Mm-hmm.
so the menopause really just means the cessation of menses, right? So once you stop, but that whole cluster of things that I mentioned that go, usually most women, we have what's called premenopause. So before you actually stop, your menses has ceases to exist. You'll start to have little things here and there.
Mm-hmm.
So vary, they may be very mild, but which usually it could be maybe the hot flashes or maybe the mood swings, let's say, or sleep disturbances, where you
Mm-hmm.
just can't. And then you go through the change that you have to go 1 year, 12 months with no cycle. And then you can say you're in menopause. Let's say you go 14 months and then you start bleeding. People will say my period restarted. No, that's called postmenopausal bleeding. It's
Okay.
abnormal and you should consult with a professional health.
Mm.
You should consult with your doctor to
That
have
check.
that evaluated, right? And that's usually with maybe an ultrasound or even what we call an endometrial biopsy. And I was just reading an article today, recertifying, and if for Black women, it could be can't, like, if you're going postmenopausal bleeding. A lot of people say, "Oh, I started my period," or no, that's abnormal bleeding.
Mm.
And some ultrasound, because Black women have fibroids or higher, can miss cancer like 5 times because it can
Mm.
hide behind them. So it's not
Mm.
something that you should take lightly or you should play with. If it
Yeah.
occurs, then you want to definitely go and have that evaluated. Hopefully it will be nothing, but you don't want to just bypass it and say, "Oh, this is just bleeding that occurs." It could typically be abnormal, and that's
Mm.
your body's way of telling you there's something wrong.
Mm-hmm.
But
Mm-hmm.
yeah, getting back to, I mean, it's no set time for how long it could. There's some. I mean, I've had women in their 80s like on hormones, and like, and the other thing about hormones is you should start them within the first 5 years. It's right. The current recommendation is to start it within the first year up to 5 years. And like if you're 7 years out, it's not recommended to start hormones. But if you're in the first year, 1, 2, 3, up to 5, you can start it, and
Okay.
usually you don't take it for more than 5 years if you want to opt for hormones.
Mm.
But it just varies. So for some people, it could last, maybe a couple of years. Some people it could last 10 years. It just,
Yep.
Wow.
Yep.
yeah.
Mm-hmm.
Now, why is it that you don't want to start hormones after the 5 years.
Well, because it's like a risk benefit ratio. So they've done studies out there. There were different studies done, like examining hormones in, women of a certain age without medical problems and some with. So the studies just found that the most benefit was gained within those first 5 years. Outside of that, then you start talking about, side effects of hormones. The worst, the obvious, like even with the birth control pill, it could, you may not have any side effects, but the worst side effects with a birth control pill that you're taking to prevent pregnancy are blood clots, heart attacks, and strokes. Now, is the incidence is not very high, but obviously people get blood clots on birth control. So with hormones, it is if you're taking hormone replacement therapy, those there are risks of things like blood clots, heart attacks, strokes. They're very minimal. I mean, and I don't know the exact, like off the top of my head, but once you don't want to be 80 years old starting the first time. That's just not safe. Yeah.
Right.
Or let's say 70. You had your stop your period at 50, and now at 65 you want to take it. No, you would take it either between 50 and 55, and usually you're not going to take it for more than the 5 years, because that's just safety. That's what's recommended. Just and get the benefits to relieve your symptoms, but not putting yourself at a higher risk of
Higher risk.
adverse events. And yeah, so, and also, I mean, 50 the 50 age, but as you get a little bit above, even with menopause, you have bone loss too. So then, it's recommended to do
Yep.
take like vitamin D and like calcium to help with the bone
Mm-hmm.
loss, osteoporosis, just so many,
Mm.
estrogen has a protective effect for women against heart disease up in, you know, that's why usually up prior to the age of 50, men have higher rates of, cardiac events. But when we get to a certain age, we kind of catch up with them. And that's because we're now in a low estrogen state.
Mm.
Yeah.
Hmm.
On the low end, how old or what age kind of can it start on the lower end?
Yeah. I mean, it can start at 45. Yeah. I mean, I've had patients who come in their early, early, like usually early 40s, and they start to have, but the average age is 51 plus or minus. So most women are going to fall between like maybe 48 and like 52 where it's going to happen. But you could be 45 starting to have irregularities in your cycles, and maybe starting to have little hot flashes here and there, just little signs. So that's not uncommon that can happen, but the majority is closer to that, closer to 50.
Mm.
Very, 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 very good information. And
Mm-hmm.
um,
Now, what are the steps that one takes to avoid all of this?
Leanne, Leanne.
I just need to know how to maneuver around it. Right?
Mm-mm.
You know,
Nope.
that's to get. I mean, it's kind of hard. Well, I guess one thing you can consider is like I've had some women who were like on birth control for cycle regulation, and as they get up to 50, I'm like, okay, your likelihood of getting pregnant is very low, but they're like, but the hormones regulate me and I feel good, right?
Oh.
The birth
Mm.
control pill. So then we start to talk about, okay, the birth control pill may you once you finish with the birth control, the hormone, it's like a different formulation. So, but it depends. Like in your case, like I don't, you don't have to discuss how old you are or if you're taking birth control or whatever. But I mean, at a certain age, our ovaries they're going to become they're going to go through what's called atresia. They are going to shrivel up and stop working. So that's just a part of life that you cannot avoid. But let's say let's say at 45 you got a Marina IUD, right? And typically that is a progesterone only. It's an intrauterine device and it has progesterone. But let's say, okay, oh, it's 5 years, you need to take it out. You can actually leave it in for 7. But for some women, it's kind of staying on some type of low dose birth control through that can kind of transition them. And then when you do go through the change, you really don't know and you don't feel it because you're on like either the birth control. So that's one way that you can kind of trying to kind of play a trick on nature to minimize it. But it's kind of like those things where you just it really just it's hard to say to what extent you're going to have it, and then a lot of it becomes just like lifestyle modifications as far as keeping yourself hydrated, exercising, your diet, that nature. Yeah.
Well, she's not on birth control because she's about to get pregnant in 2024. But
wow, wait.
so my question is,
I hate him so much.
could a woman start taking this birth control later, like say if they're in a later 30s, to kind of try to prepare for this?
Yeah, well, I mean, when you're taking birth control in your 30s, it's different reasons people take birth. Obviously, the most common is to prevent pregnancy, but we also use it for cycle regulation. Some women have very bad PMS, so sometimes we use it and suppress the period altogether.
Okay.
Because during that time when they have their cycle, maybe they have very bad headache. They could have bad headaches or mood swings, just something that happens around the cycle that they want to kind of eliminate. So you can do continuous birth control where you skip the placebo pills, which are the iron pills, and you don't have a period. It's called continuous.
Okay.
But there was something I was going to say, but I forgot. I know. I was going to say taking birth control for like 5 years also has a protective effect. It decreases your risk of uterine cancer and ovarian. Yeah, like if you use it for 5 years. Also, breastfeeding is protective against like um, things like ovarian cancer, because breastfeeding and pregnancy. Why? Because when you're pregnant, you don't ovulate. When you're breastfeeding exclusively, theoretically, you don't ovulate. So those are just some, little tidbits of benefit things of taking that. But I mean, if you're in your 30s and you don't need birth control, obviously less is more. We're not going to recommend that you get on birth. No one is going to recommend that you take hormones to prevent menopause. That's just not like a common held. Yeah. So it's kind of like, that's not something that would be recommended because that's not practice. And it's no need to take something that you don't really need to prevent that. When you get to those stages, when you get to that point, it will just more or less be a matter of saying, okay, this is where I'm at. And then if you don't want to take hormones, like I said, there are some natural things that you can do and take that will help. And sometimes you have to switch around because you may start with something that works very well, and then as time goes on, it no longer works, and you have to transition to something else.
So
Now you said diet and hydration plays a big role. What type of diet things should we be looking to do or not do?
Right. So, well, obviously hydration. A lot of I mean, and I have to tell myself this too. Like even headaches, like most times you have a headache is due to dehydration. So keeping yourself, it's kind of like a well-oiled machine. And a healthy diet is going to be, I would say, like a heart healthy diet, right? So one that's like low in sodium, low like salt, a not you need certain carbs, so healthy carbs, things of that nature. The Mediterranean diet is a good diet. Not to say you can't eat meat, but if you just look, people in the Mediterranean kind of live the longest. So those are, and when I say it's more a lifestyle because I don't really believe in diets. Yeah. And then if you're not really, I mean, exercising is good, but something as simple as walking for 30 minutes a day, 5 days a week, that's usually what's recommended. And then as like when you're nearing obviously getting to weight bearing exercise, which walking is one, like lifting some small like 5 or 10 pound weights or carrying them with you, things of that nature.
Good.
that sounds great. I mean, I think I know my next business. I'm going to probably invest in some little fans to sell all
I got my fan right,
listen.
in my purse. I pull it out all the time.
Yep.
I haven't needed it though since last. I think I used it once since last Sunday because I'm taking. I stopped these pills, but I had to go back on them. I couldn't take it.
And here's the latest fan. Have you seen this one? It goes on your phone.
Oh wow! Okay.
So you can pretend you're looking at your phone and get cooled off.
And then get cooled. Oh, so you're over there using a fan also, huh?
Several in every room. Unbelievable.
Well, I mean, hey, there's at one time there's times I stuck my head in the freezer. I mean, I heard people saying that, and I'm like, really? Yes.
Whatever it takes.
Whatever it takes.
Yes.
Mm-hmm.
Wow. Good information, though.
Yes.
It was.
Mm-hmm.
I don't know. I don't have to ask because I mean I don't have menopause.
Well, and another thing, and just you have to, and like if your partner, like let's say sometimes men will say, it's funny you say that, will say like, you have the window open, you're hot, but one thing I didn't mention is you get very hot, but then you can get very cold.
Yep.
So the process of having your fan on and the window open, then you get chilly, so you have to get all the blankets. So
yeah.
So it's up and down, and it can disturb other people.
Yes,
right?
it can.
And sometimes you're miserable. It's not that you're a miserable person, but it does not feel good.
No.
And you got to kind of let the people around you, like, hey, this is what I'm going through. Because sometimes they'll say, how long is this thing going to last? And like you said, I don't know. I'm just saying, but I'm going through it. So you have to bear with me because it is a process. It's not, I didn't ask for this. It's
yes.
And sometimes men, aren't as understanding because they're cold and, they're cold, they're hot, and so are we. But it's not, so that's one thing you got to kind of mention to folks and let them know.
So fellas, get ready to get pneumonia. Get ready to get pneumonia.
Look, I gotta put my fan on right now.
Jacket and zip.
Doc, you are not alone. You are not alone.
So we have to be older and get pneumonia, and we might not make it because you guys are playing with the heat.
Hey.
This is how we're doing.
For this, we gotta go through 10 months of pregnancy.
Yep.
You have to have a cycle for 40 years, and then you gotta go through this. Come on.
I tell you.
Man.
Yep. No win-situation.
No win at all.
None.
So, like says the big change because you guys, your body is changing.
Mm-hmm.
Right. And like you said, what you have known for maybe 40 years, but you got to kind of relearn yourself at that time as well.
Yes.
Kind of sounding. That's what it's kind of sounding like. Which is it's tough when you're learning yourself and trying to teach somebody else about what you're going through as you're learning it. So it's hard to tell them. But like I said, it's good for us to hear it because I need to know why. I'm like, she's really going crazy, guys. You tell your boys like she lost it. I told you she was crazy. Like, nigga, I told you it was crazy when you met her. Like she is.
Daryl, we need very understanding mates during this time. Very, very understanding.
I need a lot. God, it's a lot to ask.
Really?
You said you want a whole bunch of understanding and not giving nothing in return.
No, we're there for you, but we need, my husband knows he has my fan set up ready to go in every room. He knows. He doesn't fool around with it.
Because he's trying to have some peace.
He's supporting. That's good.
Exactly.
He's trying to protect his own peace. Like if I have the heat here, I don't got to wear it. If there's a blanket here, I ain't got to wear it. I got my own blanket. So I got an emergency blanket. There's a blanket under the bed he got where he can just pull it out for himself. When you take all the blankets, he'll be good.
We're all trying to get through, Daryl. We're trying to get through it.
Right. But like I said, that's why it's very important for, I think, both sides to know this, so you don't think she's losing it, and you can try to be there and comfort her as long as you're home and you're not at your side joint's house. have these feelings. I guess to be really messed up if your side joint and your main joint got.
That's gonna be the curse of it. Yes. You're gonna get double whammy.
I can't win. I'm about to just go home and be a good man at this point.
Right.
No, it definitely sounds like something very terrible. But premenopausal, Diane. It's. I know some people said you can still get pregnant during the. Sometimes premenopausal, a lot of people get pregnant during that age. They think that they're going through it, so they say we don't need this anymore. Take that off, and she's pregnant. Is it?
Yeah, that can. Yeah, so some that can happen. I mean, I think the oldest patient I've had was 46. Right. I don't know if she thought she was going through that, but I worked with a nurse who was like a labor and delivery nurse, and she thought she had a tumor.
Lord.
She was like 5 months pregnant. I'm like,
oh my goodness.
Whoa, the tumor grew. Like, even if you thought it was a tumor, we were going to go get it checked out. Sure enough, no, that's a baby. So yes, it does happen. But I mean, I think people stop their period and they think, oh, my period stopped, but at 42, yeah, that's young, right? So 43, maybe even 45. So it's just, you got to kind of be you got to be kind of in tune to that and not think like, oh, my period's skipping or I'm this age. It can't happen, because it definitely can.
Wow.
Mm-hmm.
Very. Hey, Ruth, somebody's fan is loud. Okay, I understand.
No, mine is off right now. It's off.
Oh,
not me.
Menopause interrupting the show. Look at that. It can show up anywhere. This is terrible. This is a terrible thing. Like, yeah, menopause. Like what is that? And whatever it sounded like, it was high power.
You want me to put my other one on down?
I don't know. It sounded like it was gas power. Whatever it was.
You should all put them on at the same time. That'll stop all of that. Unbelievable.
I know.
That's very interesting. And so does it ever kind of level out?
Eventually, it'll stop, because like I remember when my mom went through it, I was like, oh, this woman's going crazy. We were sitting there laughing, and then I'm like, is it over yet? Or like my sister would try to say, oh, it's menopause. I'm like, no, it's not, because I saw when you were going. Well, I mean, how am I going to tell her, right? It's her body,
right.
But eventually for most people it subsides. It'll fade.
Mm-hmm.
Yeah.
But Doc, is it true that if it subsides and even goes away for some folks, then some of those symptoms can reoccur? I've heard of that too. When you it's been several years and then it comes back.
Well, I mean, if like I had a 6 month where the hot flash, they went away. I was like, oh, I'm out, I'm in the clear, and then they came back with a vengeance. So I usually,
that's bad.
I was just like, oh my gosh. But I don't know about going away for 2. I mean, I guess anything's possible. Usually it'll go away for a period of time, like months.
Okay.
And think, oh, it's over, I'm done, and then it starts back over, because just mean that your hormones, even though they're low, for some reason, it's not like you're making zero. You make maybe that month your ovary maybe made enough to where you have symptoms. But it can definitely wax and wane, like come and go, where during certain periods of time it may just be out of control and then it kind of goes away. But usually once it's sort of like continue where you have it, if not every single day, but like consistently, and then it eventually sort of tapers off and fades away.
Okay.
But there's no set time to say, okay, it's a 1 year, 2 year. It just varies from person to person, and it varies the length of time is it varies as well.
Wow. Okay. Basically, no hope. Thank you for confirming.
So it definitely can be tough, but
Mm-hmm.
yeah.
Okay.
Wow, that was a lot of information. I hope you guys all digest this, and y'all need to figure this out because
I know.
I can't be dealing with this. I'm trying to have some peace.
You try to have
We need to have your husband come on and teach us what to do. Right? He sounds like he's an expert. He can help us men out, like what to expect and how to take care of it. Okay.
that'll be the next show. That's
Right.
because like put a little tent in the backyard for her.
That's what he did for me. Yes. He's like, you stay out there. You be cool.
You stay in your igloo. Regulate yourself.
It works. Yep.
Yeah. So it was like I said, it was a lot of information. We really appreciate it, Dr. Scott. It was very informative. Does anyone have any last questions? And again, you always can write comments. You can write us. We would get them over to Dr. Scott to see if she can help out and answer some of these questions. But like I said, we definitely thank you for coming on, taking time out. I know she works hard. Okay. Probably delivered 14 babies a day. Okay, listen. So we appreciate you taking the time out to come and bless us with the knowledge that you bestowed upon us. So we thank you, Dr. Scott.
oh,
Thank
you're
you.
Yes, thank you so much.
Thank you.
Any last words, guys? Dr. Carissa.
No last words. This was a good one. Lots of great information. I'm glad I got to hear some things that I didn't know about that might be helpful.
Mhm.
well, y'all can invite me back for your next health topic.
Oh, we
Yeah.
definitely.
Right.
Awesome.
Yes, we sure will. Yes.
And
Women-
this yeah, women's health, and their health in general. We definitely need an expert to come kind of help us and lead the conversation. So we love that. We definitely love that. It's great. How about you, Ruth? Any last words?
Wear less. Wear as little as you can get away with.
oh yeah. Yes.
Educate your husbands and your mates or your significant others as much as you can. Let them know what you're feeling instead of just rolling your eyes like I did early on when I didn't quite know what was happening to me. But talk about it. Let's just share and learn. So, and thanks, Dr. Scott. We appreciated you.
You're welcome. Sure.
Hey, Peaches. Any last words?
Yeah, I'm gonna start putting together my menopause survivor kit. Gotta go get my fan, blanket,
Leanne.
take care of all that, get that situated.
Don't forget your thermostat with an app.
That's it. That's it.
Hey, Leanne, you might be on to something. You might have to take that patent. You might have to
Listen.
It was very interesting. I learned a lot myself. What to look forward to. It doesn't look good, but definitely is a lot that is to come. And hopefully, since knowing more, I can plan for it and definitely help deal with it more by probably staying out the house a lot. I ain't gonna be cold and hot every 5 seconds.
Oh my goodness.
I ain't got time for this. You over there sweating all crazy for no reason. I don't understand that.
Unbelievable.
And Dr. Scott, last words. Would you like to say anything?
This too shall pass. Just
Even if it takes 10 years, right?
that's what we pray it doesn't take that long.
Hey, we want to thank everybody for joining us tonight. This is one, like I said, we definitely rewatch it. It was a lot of information you probably missed. So go back, rewatch it. Banana's going to take some clips and put them out there for this one because we need it. This was one that is really going to be helpful. So I'm really appreciative of this one because we definitely learned a lot. So look, check us out. Nothing But Answers Facebook group. Please keep inviting people there. Our Nothing But Answers YouTube channel. Please continue to like, share, subscribe. Let's get our viewers up. Like information like this needs to get out, and those likes help us get us into the algorithm that people start seeing us more. Okay, so help us out, help other people out because this information needs to get out. We thank you. Anybody want any content you want us to cover? Please inbox any of us. Write it in the group. We'll get it. We'll respond to you. And if it sounds like something that we can deal with, we will cover it. Okay. If you want to be a guest on the show, Cash App us. Thank you guys for. Hey, thank everybody. We had a good night. Bye.
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 Erica said you need help, Daryl. They don't know